On teen pregnancies in the country. Dr. Ademola Olajide, he is the representative for Kenya for the UNFPA, as well as Jedida Maina, the executive director of TICA. And as we get into our discussion and talking more about how to address this issue in the context of this global pandemic, there's a tweet coming in from Katebes, who is a faithful viewer of Citizen Weekend, if I may mention. He says, Vicky, I teach girls in high school. When we closed, we had 3 expectant. I already have rumors that around 10 in a class of 49 are expecting. This is the major challenge as we reopen schools. A lot of teachers, parents, community leaders are extremely worried about the issue of girls dropping out as a result of this pandemic. Dr. Olajide, when it comes to the issue of reintegrating these girls to school, we heard 3 of them saying they would give up on their dreams, one wanting to be a nurse, another a lawyer. Dorcas Wangira in the report saying that the re-entry policy is just good on paper. So how do we ensure that in a practical sense we get these girls back to school, and what could be blocking them from doing so?
Well, thank you. I think the first thing is we have to do everything possible to prevent them from getting pregnant, because the moment they get pregnant, the policy is there, but in practice, who's going to take care of these kids? How are they going to get the resources to take care of themselves and take care of the children? And of course, there's also the issue of the stigma. And so the policy is good, which we really celebrate. The practical situation of these girls provides a formidable obstacle for them in accessing education. So if we are going to be able to get them back into school, we must have social protection mechanisms. We must be able to create systems within the entire community, reinforce those systems to help them play the role of being a girl, access education, but as well as now being a mother to take care of the newborn. And of course, they now must have some form of income without necessarily having to work, because child labor cannot also be a way out. So it's complex, and that's why we need a total community approach driven by the evidence and a very honest conversation to put an end to this.
No, it's an absolutely complex situation, as you mentioned. Jedida, you work with these girls in the informal settlements. What do they say? When they're in those circumstances, many of them have a desire to go back to school, but for various reasons will not. What are they saying in terms of the barriers and challenges that they're facing when they're thinking about furthering their education?
So like Dr. Olajide is saying, one of them is very much the problem of childcare. Most of their families and parents will refuse to support them. Most of the time, parents will see them as a failure and will be ashamed of them, and sometimes they're even chased from home. So they start to rent homes, their own house, especially in slum settings, where they now need to either get get married early, and they get into really bad relationships that then to fend for themselves, or start to have sex for money, to fend for themselves again, and their child who's now a burden on them as well, which means that they now can't get time to go off to school, even if they wanted to. So when we're thinking about the barriers, and if we want to bridge the barriers, we need to provide free places where they can take their children, like for childcare while they attend school. There's the issue of stigma that is impossible to deal with sometimes in the same school, and I know the school health policy provides that they should be supported to go to another school, get admitted into another school should they need that. But also there's the challenge that most principals do not support re-entry. Some principals in schools have not even seen the policy itself. For that reason, they do not allow for girls to re-enter, sometimes even for the misconception that allowing pregnant girls back in school will encourage others to get pregnant, which I see as a complete misconception. If I'm to share with you, when I was in school, a friend of mine got pregnant, and our headmistress allowed her back, and the struggle we saw her go through being a parent and being in school convinced the rest of us that this was not a choice that we wanted to take. So it is a big misconception that allowing girls to come back to school would make others think that it's an easy way out. The other challenge also is that parents, once they see the child who's gotten pregnant as either a shame or a disappointment to the family, and with meager resources, sometimes will choose to take other children to school other than her. So they will prefer other children. Like if you have 5 children and one got pregnant, then you take it that they do not qualify for your support anymore to go to school. And this even happens when kids have scholarships. You'll find like really bright students having school scholarships, and then they get pregnant, they are kicked out of the scholarship program, which then renders them unable to go back to school even when they want to.
Right, several factors there really affecting the reentry. Dr. Olajide, I want to go back to something that you said earlier, that we need to move away from sentiments and address the evidence. And there's a tweet here from Ephantus Mutiga who's saying, from Embu, sex education should be made part of the syllabus. Proper education can make teenagers understand the danger of teenage pregnancies, hence avoid it. And one particular issue that has gotten a lot of pushback is the introduction of the comprehensive sexuality education. What's your take on that? Because there's several groups saying that it would act more as a catalyst than a deterrent in terms of the sexual behavior of young people and teens. What's your take on that?
Clearly, providing young girls and boys with the life skills necessary to delay onset of sexual debut, to protect themselves and make the right decision is key if we're going to be able to solve this problem. The issue is this: I've been doing this for years now, and the term comprehensive sexuality education or sex education sometimes creates a problem in itself and not the content of what we want to pass across. I'm an African. I may be speaking in English, but sometimes I think in my native vernacular. And so I might struggle with the native interpretation of comprehensive sexuality education or sex education for young girls. What we need to do and what we want to do is to improve the agency of young girls and boys to increase the age of sexual debut to well beyond their teenage years and take the right decisions to protect themselves. And one of the best ways of doing that is to have it in school. I'm a diplomat, but then I will shake the table and go straight to the point. First thing, teenage pregnancy cannot be wished away. Teenage pregnancy cannot be prayed away. Teenage pregnancy cannot be policed away. Whatever we do, we must improve the agency of the girls and the boys to take responsibility for their lives and take the right decision. That includes ensuring we have life skills education within the school system and also within communities, that parents are equipped with the capacities to be able to talk to their children and guide them appropriately. It has to be the entire society. We cannot wish to go back to the Kenya of 1950 where cultural values guided us. The world has evolved. People take information from various sources right now. We have to create a channel that is reliable, that is respectable and responsible to provide them the factual information and skills as well as services when they need it.
And Jedida, I want to bring you in on a point Dr. Olajide just raised of engaging one aspect of teenage pregnancy that we hardly ever talk about because we focus almost entirely on the girls, and that's the boys, especially when it comes to peer-to-peer sex. And you know, you're dealing with boys who are equally as young, they're minors, they're scared, they're not as educated or exposed as these girls are too. So when you're talking about engaging this part of the equation, the boys, you know, how do we do that as well?
The way we engage the boys is exactly the same way that we engage the girls, by creating safe spaces where we can share information in and out of school by parents, by other trusted adults, in a way that they receive information that's factual and they know how they can act on this. I think because pregnancy can be seen, sometimes we think that pregnancy is the only issue. There is HIV, there are STIs. If young people are engaging in unprotected sex, they are all being vulnerable to this. And we are not protecting our children because we are shying away from having this difficult conversation. I'm sorry, when we choose to keep our children ignorant, we're not saving them from unwanted pregnancies or diseases. We're just making them easy predators, easy prey for predators, you know. When we have worked with children, Tika runs safe spaces for adolescent girls and boys as well. And when we have these conversations, we hear of all the misconceptions there are. For example, the belief that if you have sex standing up, you wouldn't get pregnant. Or if you had sex at a certain time, for example, when you're having your period. Sometimes girls, even at the point where they are 9 months pregnant, they don't even know what's happening to them. This is because even just basic information about how their bodies work, how adolescent is, what changes they should expect on their bodies, this is information that no one shares with them, both boys and girls. If boys and girls have spaces where they can have this information from somebody who's trusted and an adult in their life, in school, if there is a curriculum that teachers can use to guide these conversations, because most of us never had any sex education growing up. So sometimes we are not good teachers to our children or children in our classes. Teachers are uncomfortable with this conversation as well. Just providing a guidance that teachers can use, if we call it comprehensive sexuality education, if we want to call it life skills, whatever we want to call it, but it needs to be comprehensive. It needs to have the information that young people need to go through adolescence safely and protect themselves from diseases and unwanted pregnancies as well.
Dr. Olajide, let me wrap up with you in terms of, as this pandemic persists, what's the worst case scenario? The UNFPA was projecting that in the next 10 years, 13 million girls will find themselves in a marriage. As a result of this pandemic, we know here in Kenya, that's a big factor as to why many underage girls become pregnant because of child marriage. But how bad can it get, especially if we don't respond now?
The figure of 300,000 young girls presented in health facilities on account of pregnancy was from the 2014 DHS. And that didn't change much from the previous DHS before it, which was about 3 or 4 years before it. And if we look at it now, it has probably gone worse. And so if we do not address it now, the conditions that COVID has already created and the response to COVID will cause this to continue to fester. Unfortunately, we've had young girls out of school and boys for a substantial amount of time this year. And we're still struggling with getting them back into school and hoping we do not have a second wave of the pandemic if everybody does what they're supposed to do. If we do not take a cap on it and deal with the issues of teenage pregnancy as we also grapple with education reentry, we are going to have it bad for us. The base of our population pyramid will continue to expand. It will be a drag not only on education resources, but also on the health and other social resources. One final point that has been mentioned. In 3 counties where we have done a study on the drivers of teenage pregnancy, we found out that in one of the counties that has a teenage pregnancy prevalence of 40%, 63% of those young girls were ignorant of the factors that could even make them vulnerable to pregnancy. And about the median age of the people who were getting them pregnant or their sexual partners was 17 to 18. So the largest chunk of the problems we are confronted with is peer-to-peer. Yes, we have the issues of defilement, we have statutory rape, which has to be dealt with as well, but the greatest chunk of the challenge is amongst peers. So yes, we have to deal with it, or else it will get worse. It's not just going to go away on its own.
Dr. Olajide Jedida, thank you so much for your time. It is clearly a discussion that we can't stop having until we start seeing those numbers go down and keeping girls in school so they can actually fulfill the purposes that they were set out to. Thank you again. Let's take a look at some of your feedback coming in. Lots of it streaming in on social media and Twitter. I am unable to see that. Teenage pregnancy exposed weakness on children. Parents relationship. Many parents engage their minds with the job-related stress, leaving no room for monitoring monitoring children behaviors. This is true. Parents are preoccupied and can supervise as well. Most of the adolescent girls lack the ability to negotiate for safe and proper sex practices due to inadequate sexual and reproductive information. Let's act. All right. Still on Twitter. This one says, if school-going girls get pregnant, it's a crime called defilement. The government has failed terribly to protect the girls from sexual predators. It's a bad state of affairs. And the last one, saying taking care of our girls is not only for the government, but for all Kenyans. Let's all wake up and protect our girls. And speaking of being proactive, just seen a tweet here from a 16-year-old called Hope Ngare saying, I have a foundation dealing with this teenage girls. I am 16 years old and a Kenyan out here willing to know I already have 5 girls and 5 babies I'm helping. That's a minor who's decided to take matters into her own hands and help her fellow colleagues navigate through this very tough time and period. It takes action no matter who you are and where you are. Thank you so much for watching Citizen Weekend. I'm Victoria Rubadiri. Our sign language interpreter tonight has been Njoki Shege. Have a wonderful evening, but remember, stay tuned.